you will be surprised to know that around 2.2 billion population in the world has some kind of a visual impairment. Cataract accounts for around 51% of the global burden, as she rightly said, of blindness. India has the global burden of blindness accounting to 20%. And of that, 63 to 65% is cataract.
The sad part is that in rural areas, the people don't have access to healthcare facilities. So many of these refractive error, which is such a simple thing to correct, goes uncorrected, undetected.
Glaucoma is a situation where we call it as actually a silent killer. Outcome of cataract surgery is around 98%. And there is nothing to fear. So things have so much advanced, the machines have advanced, the technology is advanced. There is not even an injection going inside the eye. Take care of few organs in your body. And if you're not under control, this is what is going to happen. Your eyes, your heart, your kidney, and the sensation. And these are the major areas that diabetes can affect. A clear vision in an elderly is so good for a safe life and a good quality of life. And I think quality of life is so very important at that particular age where, not everything is in place. And I think it's so very important here. Hi everyone, thanks for joining us here today. Shaifali and me are back again. Of course, as surgeons, we really do have hectic life, but we try and, do this iTalk and be here. And we are very passionate about this particular thing. And for the same reason, we are back here again to discuss a very important topic today. And this is something that affects billions of people in the world. And it is considered to be a major global health issue, and that is avoidable blindness. And it is very important to raise this awareness, as when we say that it's avoidable blindness, it indicates that this is a situation where eyes can become blind, but it can be fixed and avoided with early detection, getting treated on time. And you will be surprised to know that around 2.2 billion population in the world has some kind of a visual impairment which can be treated. And that's exactly what we are going to touch upon today. Yeah.
Yes, absolutely. So we are here to chat about and discuss how so many of these cases of blindness globally could have been avoided or prevented. In fact, most of the cases happen because of reasons like cataract, which could have been easily treated. Do you know about 1 billion people in the world have some form of vision impairment, which could have been easily avoided or fixed?
Yeah, exactly. So we have 2.2 billion population with some kind of, visual impairment. And 1 billion is easily fixable. That is 50% is fixable. Now, the important thing about the data that we have in our hand is this is the global burden, right? So cataract accounts for around 51% of the global burden, as she rightly said, of blindness. And around 39 to 40% is refractive errors. Refractive errors means you could be having a short-sightedness, a far-sightedness, or an astigmatism. And then there are many other causes, and that's exactly what we are going to break down everything to. It could be glaucoma, it could be diabetic retinopathy, it could be a corneal opacity, and it could be an age-related, degeneration of the eyes. And isn't it crazy to know that, since we are in India, and to see the perspective, the Indian perspective, India has the global burden of blindness accounting to 20%. And of that, 63 to 65% is cataract. And it's again, a good news is that this can be fixed, as Shaifali said, easily fixed. Well, taking about refractive error, I think, Shaifali, you should just kind of, touch upon how refractive error is so easy to be detected and treated.
Yeah, as you already mentioned,
Yeah.
refractive error could be nearsightedness, farsightedness, or astigmatism. And they can be easily treated by something as simple as glasses
Yeah.
or contact lenses.
Yeah.
And in some cases, surgeries might be required. The sad part is that in rural areas, the people don't have access to healthcare facilities. So so many of these refractive error, which is such a simple thing to correct, goes uncorrected, undetected. And that leads to such a burden for these patients, because it decreases their quality of life. In fact, in the urban population also, we
Yeah.
see so many patients coming in who are well into their adulthood, but they're coming in for their first eye examination. And maybe sometimes in that eye examination, refractive error is detected. Children, they will never complain. So many parents bring in their children when the power has increased so much that we cannot fix it perfectly with the glasses or contact lenses that we can prescribe. And it is very heartbreaking to see actually
Yeah.
such cases, because this is the simplest of the avoidable blindness that we can correct easily.
Right. So when we talk about refractive error, which is so simple, give a glass and the patient gets the vision. So easy. You walk inside the clinic, get a glass, checkups done, power done, and then you get a glass. But the sad part of, countries like India, like we have poverty, right? Yeah. And the sad part is in certain rural areas, the patients doesn't have the financial backup to even buy a glass and prescribe a glass. But luckily and fortunately, we have so many, blindness control program in place at this point of time where even glasses are dispensed free of cost in certain rural areas. So leave the rural areas apart. We're talking about urban areas, as Shaifali rightly said. Kids don't complain, and there are shocking situations where parents get a call from the teacher from the school when a random eye screening has been done, and they say, okay, your child is not seeing clearly, and the child has never complained to the parents. So these parents get a shock. Oh my God, seeing bad, and they get panicky about the situation. So how could have this been avoided? It could have been avoided if the same parent took the decision and initiation to bring the child for a regular eye checkup. A child should have a regular eye checkup before going to school, and when the children have reading, close reading, they can develop refractive error subsequently also. So it's so important to get the eye checkup done in this growing age group as they grow, to check whether there is any power, and it's easily treatable. Right. So, yeah. So that is about the refractive error. Another thing that we really want to raise awareness is regarding glaucoma. Right. What is glaucoma? Glaucoma is a situation where we call it as actually a silent killer of vision, a silent thief of vision. It just, very slowly, progressively, it kills the vision, and patient will not even identify. And if it's treated early, detected early, we can actually preserve the vision. And what does glaucoma do is there will be an increase in the eye pressure. Now, because of the increase in the eye pressure, it damages the optic nerve. Now, what is very crucial and critical about the optic nerve is that it's the only nerve in the body that doesn't regenerate. Once damaged, it's damaged. So we have to avoid that damage in detecting the disease early. Now, it is also a genetic disease. So, when there is a glaucoma in the family, running in the family, it could be a sibling, it could be a mother, father, maternal, paternal, aunts, uncles. You should identify, if you know that there is a glaucoma running in the family, and early screening has to be done. As early as 35 years of age. In your 30s, you should get an yearly glaucoma checkup done, because you have a high risk of developing this silent killer of the vision. And if you start the treatment early, we can actually stop the progression of the damage. A damage once happened is done. So further damage can be avoided. And if it's too difficult to treat with, and it can be treated with eye drops. It's very simple to treat with eye drops. And if you cannot treat it with eye drops, there are advanced surgeries which can get it under control. So in fact, we don't want to reach that level of, going to an uncontrollable glaucoma with the eye drops. We try to control with the eye drops. So, and it's also preventable. It is avoidable, it is preventable, and it is treatable.
Talking about glaucoma, actually, I would also want to create awareness about over-the-counter drugs that some people
Yeah.
use
Oh,
because
yeah.
of many conditions. You
Right.
go to a pharmacist will prescribe you a drop which might have steroids in it.
Yeah.
While steroid is a magical medicine, but it should be used with so much of caution.
Yeah.
We
Yeah.
have had patients walking in
Yeah.
who have randomly off and on used steroids, which can increase eye pressure.
Yeah. Yeah. Anything which increases the eye pressure can cause optic nerve damage. So she rightly indicated that please don't go and use over the counter drugs, which, you may not be knowing, which is causing, side effects like increase in the eye pressure. Yeah. And the other thing is, which can be avoided in a large scale, and we have that global burden, something called diabetic retinopathy, right, Shaifali? So, yeah, you
So
wanna, yeah.
diabetes, as you know, is like so rampant in the society these days. And one of the very important complications of diabetes as a systemic disease is
Mm-hmm.
the eye complication, which is called diabetic retinopathy, which is simply diabetes affecting the retina of the eye.
Mm.
So it can start off with a simple bleeding, because what happens in diabetes is it is affecting the blood vessels of the body. It can affect the heart, brain, kidneys, as it can affect the eye blood vessels. So
Yeah.
blood vessels can leak. It can start with a small leakage, which can cause a very small hemorrhage, which we call a dot hemorrhage, which is the dot bleeding. But as you said, that glaucoma is a silent killer. Diabetic retinopathy is absolutely silent. You will not have any pain. You will not get any vision threat if it is happening somewhere in the side of, like the periphery of the eye. And when it has become too much, the bleeding has increased, then the patient probably will have some visual disturbance for which they might come in for a checkup. But it will all happen silently, and it will happen over a period of time. As you know, diabetes is also a lifelong disease. It's a chronic disease. So once you are detected with diabetes, minimum requirement is that you should have an annual eye checkup, because it can also lead to permanent loss of vision if it has increased to a very severe bleeding or a retinal detachment. For which surgeries are there, but they might not give a good outcome as when it is detected early and treated on time.
Yeah. So don't get surprised when, when we kind of share stories which you think, oh my God, how can this happen? So this was like a professor in one of the major colleges, right? A very smart lady. So she just came in and she said, I'm kind of seeing less. You might be remembering her.
Mhm.
And then when we go and check inside the eye has completely bled. Okay, and she was diabetic, well, kind of uncontrolled diabetes status, and the eye has completely bled. It's not that she was very educated, she's aware of what's going on. She know about her diabetic status, and then I asked her, "Don't you do your eye checkup every year?" She's like, "No, I didn't know it." So I think the onus is on the diabetologist, the physician, of course, the ophthalmologist, to create the awareness that diabetes, which is a chronic disease, if not controlled, can affect the eye and the patient can be blind for lifetime. We're talking about this. So, just today, right? A very good, he's a senior eye specialist. So today I was just talking to him and he said, listen, I'm having some problem. And I just called him, what is the problem in the eye? He just told me that there is something going wrong. And then he said he has a retinal detachment. I'm like, okay. So I was like, why? What is the cause of the retinal detachment? That retina just, detaches from its uh, normal place. And then he said, it is because of diabetes. I'm like, well, you're an eye doctor. It has to be under control, it has to be checked. And I asked him, like, when did you have your eye checkup done? It was like everything was going normal. And, it was like I missed a yearly check. And it's like 2 years before. And this happened in 2 years to an eye doctor
Yeah.
who's a surgeon, So sometimes it's just not the lack of awareness. Sometimes a little bit of a laziness creeps in where you're like, okay, you're being positive that everything is fine. So I am not having any pain. I'm not having any problem. So I'm going to miss this checkup. But it is so mandatory. It is so critical that if you are a diabetic patient, one, you have to keep the diabetes under control strictly. If it is under control, it's not going to affect any of the organs, neither the eye, the heart, the kidney, or any of your, nerves. But if it is not under control, it can affect, and you have to have a yearly eye screening. Very, very important. And it's very easy to treat it early. Very
Yeah.
easy to treat it early.
And
Yeah.
as we tell our patients, eyes are the window to the body.
Yeah.
So with a simple eye examination, you can actually know the status of your sugar control also. That if
Yes.
changes are happening in the eye, that means changes are happening in other organs also.
Right.
So that also makes it a quick and simple way of testing whether your
Yes.
sugar is under control.
Yeah. So when a patient walks in with telling that they have a history of diabetes, what I tell them is like, take care of few organs in your body. And if you're not under control, this is what is going to happen. Your eyes, your heart, your kidney, and the sensations. And these are the major areas that diabetes can affect. So just being aware of it. Yeah. Now, when diabetes often seen in the older age group, but we can have type 1 diabetes even in younger age group. Another cause of blindness, which is again very silent, patient will not know, is the age-related macular degeneration. It is age-related degeneration of one part of the eye, the central portion of the eye, which can lead to blindness. There can be fluid accumulation, there can be bleeding in a similar way, and then they can gradually go in for bleeding. And it doesn't have to be a sudden onset, it's usually gradual. Now, the question will be, how can we know it? So, the answer is very simple. Each and every one of you have to get a yearly eye checkup done, irrespective of the age. In younger age group, it could be a refractive error, which can cause blindness. In older age group, it could be the age-related macular degeneration, which can cause the blindness. Now, corneal opacity, do you want to just touch upon?
Yeah,
Yeah,
so
right. Yeah.
cornea is the clear front portion of the eye.
Hmm.
So opacity is just the loss of the crystal clear appearance of the cornea.
Like a scar.
Yeah.
Yeah, yeah.
And for that, also the surgeries are available. Corneal transplant is available, which can restore the vision back so wonderfully well. In fact, the surgeries have advanced so much that we can just replace a single layer which has gotten affected in the cornea.
Yeah, so there are like even kids who, who are born with this central white opacity. So if the central portion of the vision is blocked, absolutely no vision. And this is so easily treatable with a surgery that you can just put a clear cornea and then the child sees the world. So all these things, if it is taken care early, detected early, it is just not the vision. It improves the quality of life. Leave the quality of life apart, it improves the productivity. Once you're blind, you're incapacitated, right? If you have a limp, if you have a fracture, you can still work, but if you're blind, it really affects the productivity. And especially in countries like India, where every person in a family actually contributes to the economy, income and economy of the family. So it's devastating when someone is incapacitated. It's going to affect the entire family with a low socioeconomic background. So it's a quality of life. It's just not the vision. And I think we all should work together as ophthalmologists, as physicians, and even as public, to raise the awareness and tell your friends and family, if you've watched this, that, these are the things. And if you think that this is going on in the family, the genetic, kids in the classroom who's seeing, kind of blurry, has to be taken care. And especially in kids with refractive error, it can cause a permanent damage, something like a lazy eye. You detect it late, by the time the visual development has already been affected. And if you don't correct it at the right time, it can be a lifelong, visual impairment. They may not go to a blindness level, but there will be a permanent visual impairment in that eye.
And now coming to the major cause of avoidable blindness that we have spoken about, that
Yeah.
is cataract.
Yeah.
So cataract is nothing but the clear transparent lens that we have in our eyes. It starts becoming cloudy. So what will happen when the clear transparent lens becomes cloudy? You will have dim vision, you'll have decreased quality of vision, the colors will be little faded. So all of these symptoms will start setting in. And cataract is also age related. When you are in your late 50s or 60s or 70s, the cataract can start. It can start slow, but it will progress with the age. So whenever you start having symptoms like this, or maybe frequent change of glasses, you can actually point towards maybe something that is going wrong with the lens of the eye. It can happen in younger age also, but the most common cause for cataract happening is the senile cataract, that is the age-related cataract that we call. Do you want to tell us about the surgery?
Oh, yeah.
Cataract.
Oh, well, yeah.
That is...
Surgery, cataract surgery in a good cataract surgeon's hand is excellent. So I would say the outcome of cataract surgery is around 98%.
Yeah.
And there is nothing to fear. So things are so much advanced. The machines have advanced. The technology is advanced. There is not even an injection going inside the eye. It's just a simple eye drop that you put, and then the surgery is finished in 10 minutes. And immediately the patient goes home, even without a patch.
Yeah.
And they see crystal clear with, anything. I mean, you can just do your routine activities even immediately after the surgery. Yeah. So that is how cataract surgery is, and it's easy. There is nothing to fear. So there is definitely, like my mom my mom,
Mhm,
right?
mhm.
She requires a cataract surgery. It's not too severe. And then I am still in the process of coaxing her, but there's a fear, that
Yeah.
something can go wrong. The chances of a surgery going wrong is very, very, very less, like less than 2%, I would say. Yeah. So,
And in the hands of a very good
oh,
surgeon, it's
yeah,
just 10 minutes that
yeah,
you go
yeah,
inside without any
yeah,
needles or anything, get your surgery done,
yeah,
and resume your activities the same day or the very next day.
yeah,
So it's just the putting of the drops that has to be regular. Otherwise, the
right,
recovery is smooth, the surgery is easy.
yeah.
So there's just the mental block that probably
One,
the public
and
has.
the awareness,
Yeah.
one of our patient, like she was in her 70s, and she was getting older, and she was getting slightly into the blinder side, and she accepted the fact that it's because of the age that I'm becoming blind. She didn't even know that, and from the urban, city Bangalore, that it's because of the cataract. And she never complained to the kids because it's like the mother syndrome. They also never complain, they just live with whatever is happening to them. And then the kids suddenly recognize that, oh my God, she's not even able to do her routine activities. Like she's not going to be able to go to the bathroom. She's not able to pick up her own clothes and wear it. And she literally walked inside the clinic like blind, totally blind. And well, it was like a white, thick opacity in the lens of the eye, which is cataract. Surgery done, and she was so elated, so happy. In fact, the entire family was like, it was like a magic for them. But we were not magicians, we didn't do any magic there. It was just a cataract surgery done in both the eyes, and she had like absolute clarity of vision. It was something like a life which has been given back
Back.
to her.
Yeah, so imagine
Yeah,
the effect of such a
yeah,
surgery that can
yeah,
happen, like that can be there on the quality of life of such people.
yeah, yeah,
And actually, interestingly, India was the first country to launch
yes,
national program for control of blindness,
yeah,
and we are so proud about that fact. And because of that, this surgery also has become so accessible and affordable
yes,
in a rural setup, in a public health care system setup
yes,
for everyone, and even in a private setup. The
yeah.
cost of the surgery is not that high for the quality of vision that you get after the surgery,
And the quality of life that you
life
get
that you
after
get
the
after the
surgery. Now,
surgery.
another
Yeah.
thing that most of the time that I tell my patients, when they say like, okay, I will kind of delay, it's basically the mental block and the fear. Now, cataract surgery is a simple surgery. You get it done and it's done. But then the consequence of not doing it in an older age group because of visual impairment or blindness is fall.
Yeah.
Okay. So these elderly person is not seeing well, and they can fall. Now the consequence of a fall is much devastating than doing a cataract surgery. You're falling down, you might have a hip fracture, you can have a leg fracture, and then it's a more complicated surgery. The recovery time is more. So I'm serious here. These are the
Yeah.
stories that we usually see. So a clear vision in an elderly is so good for a safe life and a good quality of life. And I think quality of life is so very important at that particular age where, not everything is in place. And I think it's so, so very important. Yeah. Yeah.
So that's why we actually, after today's chat, we would want to urge everyone that if
Yeah.
you are having any eye symptoms or your loved ones is having any eye symptoms, don't
Yeah.
wait.
Yeah.
Everything will start slow. Everything will increase if not treated or detected on time. So don't wait for a good quality of life or a clearer vision, and reach out for help to your eye care specialist. We are always here to cater to your needs, to
Yeah.
detect things early, and to provide the best possible solution.
Right. So basically, the call of action today here, both being here, is one, to raise the awareness of all the causes in one bag regarding the avoidable blindness globally and in India that we face. And, one is, of course, the cataract. And the most simplest is to get a glass when there is a refractive error. There are people even delay taking glasses also. They'll think like, okay, can we do something like, an Ayurvedic treatment or putting eye drops, and kind of delay. The more you delay, you are setting in a lazy eye or an amblyopia. So this is what we wanted to do in this episode here today, just to create the awareness of avoidable blindness, a blindness that can be fixed and avoided in various circumstances. thank you for being with us here today. And I hope it has been useful listening to us, and some amount of awareness have been created. So please, 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 if you are the listener and if you have any issue, even the slightest of a blurriness in the eye, please go see a doctor. If it's your mother, your father, your siblings, or friends, kind of coax them that they should be visiting a doctor.
And make your eyes a priority.
Yeah.
And also go in for a regular annual eye checkup to your eye specialist.
And we agree, as an ophthalmologist, we are not being partial here. We ask you, isn't eye really important for a good life? I think it is yes. I think you would agree. Yeah. Thank you. Thank you for being with us.